I'm Dr. Ramesh Kancharla. I'm a founder, chairman of Rainbow Children's Hospitals, and I'm pediatrician basically. I was trained as a pediatrician. I went to UK to further train myself. I got my membership exams, and after that, I focused on specialty care, especially kind of a neonatology, and eventually I ended up in doing a children's subspecialty called pediatric gastroenterology, liver diseases, and transplantation. So that's my training background. So I've always wanted to come back to country. So that's one of the decisions which I've always made to come back to the country to do something back to the country. So that's where we were. We wanted to come back and try and establish the pediatric health care. In the process, what has actually happened was that when we were seriously intending to come back, we couldn't really find a right place to work. See, because when you're specialized, when you can do healthcare for sick children, and you need infrastructure, you need an environment, you need a team. So that was something which was seriously lacking. So I went around whole of South India. The patchily, some doctors were doing a good work. So then actually that made me to think, okay, let's do a comprehensive children's hospital. And fortunately, some of my colleagues have come along with me, and then we were 5 of us started a Rainbow Children's Hospital. In pediatric beds in the country, what I say is proper pediatric beds. There's no real measure, but I wouldn't think it's more than 5,000-6,000 beds, proper beds, which can be catered for children with serious diseases. So that's how the state. So when you look at children's population is about 30%. The up to 16 years time, much more than 30%. So this is the population we are dealing with, and then we have a very short of beds. And when you look at the world scenario, see that I was in UK, I know that there were about 9 referral children's hospitals, which are more than 250 bed hospitals for a population of about 6 crores. So that speaks that what are the number of beds we are short of. I'm not counting the beds which are in the multi-specialty hospitals, and the pediatric hospitals are far less for the population what we have. Even in the city, that's what surprisingly, even in the cities, we are very short of beds for the pediatric health care. As a professional who is trained in advanced children's hospitals, I was at Great Ormond Street Children's Hospital, so my dream was to work in a hospital in India, something like that. So, or at least work in a children's hospitals. So with that vision, I had come back to work. So unfortunately, we couldn't find a right place to display our skills. There were children's hospitals, but they were actually very basic hospitals. So whatever the training I had was not going to be useful. And fortunately, we had some of the colleagues who had come along with me. We started a 50-bed children's hospital. A lot of focus on saving sick children and babies. So we focused a lot on children's intensive care services, neonatal intensive care services. Further to that, we started building the specialties. Like I myself is a children's gastroenterologist. My colleague was a nephrologist. Another colleague was a pediatric hematologist. So we started focusing on the children's specialties. One of the major things we have done is that we decided to do a consultant-led service, which means that you are on call as a senior person who has got skills to support the intensive care services on site. So all of us were full time. We were very sure about what model we were trying to work on. We wanted to go with a more of British Canadian model, which is you build a hospital and you build a solid model for both paramedical nurses as well as doctors. All of us are full time. None of us practice outside. So we work 24/7. So one of us being on call on site. So whoever is required in the night to come back, we come back and support. So this is a basic platform. We made it very solid. We worked on that for 4 or 5 years time. So subsequently, what we have seen is that we started looking at building the training programs. when we expanded. So our building, the training programs have started getting matured. So we were able to get more number of people to participate in the same model. So the 3, 4, 5 years down the line, actually we were well accepted by the community and the young parents of the city. See, this is what the success is. Then started looking at us to send sick children to us, because when it is anything beyond them in the middle of the night, early hours, so they started sending to us. And also we parallelly, what we have done is that we established the transport services, because we are in the city, most of the children are around in the districts. So when they fall sick beyond a point, so coming in the very conventional ambulance to the city is dangerous, number one. A lot of children have lost their lives. This is where one of the sensitive areas which we have explored. So we developed the transport services to go and pick the child on a request, the newborn or child, on the request of on the doctor. Whenever there is a call comes to us, we go and do. We have started doing about 250 kilos radius, because beyond that it's impossible. So it becomes more than 7-8 hours time. So we have started going around the districts of Hyderabad, which is Telangana districts, and also we started touching some of the northern Karnataka the district like Raichur, Bidar, and we started going to Nanded in Maharashtra. So this has been going on very well. So now sitting now in 2016, we have been about 16 years we have run the intensive care, the retrieval services, which is the pediatric emergency transport services. And on average today we do about 200 transports, which are distant transports from the outside the districts to the city. So this has actually made a lot more comfortable to the doctors and some of the parents, because I'm not saying we are doing all the retrievals, but we are able to do some of the retrievals. I'm able to save some of the sick children and able to support them on the road to come to the tertiary unit. This is one of the major area where we have a problem. In the cities and districts, there are fairly good ratio of pediatricians. We do have a very excellent pediatricians who can do a primary and secondary care. Where the gap comes is that the children's domain is like a adult domain. We have children who requires children's heart care. We have children requires children cardiac care. Gastroenterology services. Children requires renal problems. Leukemias are separate, and intensive care services are huge. So essentially, today's adult multi-specialty hospital is well established. Whereas children's multi-specialty hospitals have been well established in the developed countries, which in UK and USA, about 30-40 years ago. So this is somewhere our gap in expertise is that we need to have a more specialists within the children's domain, which is the neonatologists, pediatric intensive care doctors. We need a more, recently the NDTV was showing about what is the number of pediatric oncologists in the country. It's about 50 pediatric oncologists. We need about at least 100 times to that to deal with the load of pediatric oncology. So pediatric surgeons. So we have a huge gap in specialists within the pediatrics. That's where actually the number of people are required. And also it's always like this. When the people are there, you don't have infrastructure. So this is something which we need to look at for the country, that we need infrastructure in the form of children's hospitals, advanced children's hospitals. We need expertise. If we couple both of them together, it's going to be a story where you can save a lot of these specialty kids and children with the specific problems. Now in 15-16 years time, we have a huge number of specialty patients with us. All our doctors, we have overflowing. Actually, we are looking at the second, third specialists in that area. For example, we have a hematologist. We started with one. We added second hematologist. We're going to need one more. Neurologists, we got 3 neurologists. Our hands are full. We got about at least 15 intensive care doctors. So our hands are full. So we need to see there is no dearth of actually the pediatric work. Question is that how much infrastructure, how many doctors you require is the question here. One is fulfilling the gap with the number is huge. We have been actually doing the training programs with the National Board of Examinations, NBE, which has been very, very supportive to try and build specialty programs to do. We have it, for example, we run about 300-bed hospital in put together in Hyderabad. We have about 50 trainees in the system. So all these people are going to have a good skills in intensive care, in neonatology. When they go out tomorrow, so they will be able to do a pretty advanced medical practice. I think we are very, very far behind in terms of children's health care. Especially, I'm going to talk about in advanced children's health care, where the need of children's multi-specialty hospitals, the need of a specialized pediatricians, which means pediatric specialists in doing a specialty work. We need a lot of intensive care doctors because children are the ones who are more prone for the sickness because infections and various reasons. When you get a dengue illness, so the number of children become unwell much more than adults. Children's hospital is very, very different hospital compared to adult hospital because I have been kind of worked in the beginning in the adult hospitals. So I've been working last 20-25 years with children's hospitals, both in Indian scenario as well as the Western scenario, and also some of the world's best children's hospitals. Basically, children's hospitals run a very, very different philosophy because primarily 80% of your patients are an emergency-based admission. Yet only 20% comes with an elective problem. So the 80% of them come as an emergency, either through the ER or through the outpatient department or been referred by somebody else, which is completely reversed to the adult. Therefore, your emergency mechanisms to deal with these sick children and emergencies have to be lot more prompt, lot more geared up, your system. And also the children's hospital is live 24/7. Unlike adult hospitals, most of them, they rather go to sleep in the night, except the emergency department or some of this emergency surgical work. Rest of the areas are pretty much quiet and cool. Whereas children's hospital, you may have an admissions of 15 towards evening. In the night, you will suddenly have a 40-50 admissions as an emergencies. So which means that your emergency is active, your wards are active, your intensive cases are active. Very often, it is very active in the nights. We have been doing a significant maternity also. See, what is happening is there's a lot of the competition in the, or a lot of, the talk about women's deliveries and boutique centers, various things. We have started a children's maternity in a different concept. We were children's hospital. We looked at as a maternity as one of our specialties. The reason is that now, which is the best place for a woman to deliver? Maybe children's hospital. If you go back and see, it's the maternal and child health is a combination. It got broken, of course, later on, but the maternal and child health is together. In that also, there is a perinatal service. Perinatology includes is a mother, expected mother, who is going to deliver, and baby's health while in the uterus, while in the womb, because you need to have a fetal medicine department to take care of that. Baby's health also, if there is anything diagnosed, anticipated problem, there is a neonatologist there. The delivery planning is best to happen in a hospital where there is a neonatal department is there, a neonatal surgery is there, pediatric specialties are there. So we rather look at as our maternity as the perinatal center. If you say we actually run as a perinatal center for a long time, because it's a Jainbow Children's Hospital and the perinatal center. There is some problem in understanding for the people what is a perinatal center in the definition, which is why we thought, okay, let's actually build as a birthright as a perinatal center.
That's more than defined.
Yeah, that will get an identified, and also it gives a description. Within the birthright, we do the maternity, we do high-risk pregnancies, we do fetal medicines, we do the neonatal practices. We also support as a children's hospital for whatever is the problems for the unborn child. We will prepare the families and take them to the successful journey. So earlier, actually, we have built over a period of time. We started with 50 beds, then we added another 100 beds, then we realized that we require more beds. Then we went around and started doing spoke models. So with this experience, what we realized is that, number one is that, today we realize that there's a lot in children's multi-specialty area. We wanted to build a children's multi-specialty area. When you say that, you require a larger intensive care services, which means we do need about 40-50 beds of neonatal intensive care, about good 25 beds of pediatric intensive care, and we have a responsibility to build all the specialties around. So overall, your size becomes 150 to 200 for a specialty. So that is a significant size to run it in the long run. So what will happen is, if you start doing a very small hospital, so you will have a shortage of space, difficult to ramp up further. Again, you're trying to do multiple areas, multiple places. Essentially, we realized that children's multi-specialty hospital does require about 150-200 beds. This is what we've designed in Bangalore. What we have done is, we have designed this hospital completely from the scratch. So we know exactly the flow of the patients, we know flow of the obstetric patients, we know the flow of the pediatric patients. There is no connection between the sick children, or no connection between the well children. So we planned in such a way that within the hospital they have got their own privacies, and we designed intensive cares to the latest standards, and we equipped it appropriately. So it is, when you look at the children's hospital in Bangalore, it is a proper children's hospital, which is comparable to any best children's hospital of the world today.